Our final presenter is ALLISON Millette. ALLISON is a licensed clinical social worker here at Houston Methodist Hospital. For the past 10 years, she's worked with the Case Management and Social Work Department, providing assistance to patients with every cardiac diagnosis. More recently, she's been assisting adults with CHD navigating the healthcare system to obtain the services they need. She obtained her Master of Social Work at LSU, where she had a lot of experience helping others deal with trauma after Hurricane Katrina. She enjoys writing and hopes to one day publish a book.
One day. Thank you for that introduction. I think it's this one everyone's been using. So I wanted to start by providing a little bit of context to this discussion about the psychosocial aspects of living with CHD as an adult. I think it's important to acknowledge that really you guys are the experts in this area, having lived with it your whole lives up to this point and having been through so much as well. So as we're facing adulthood with CHD, what we're realizing is a lot of people are dealing with depression and anxiety more than their counterparts without a major medical diagnosis. Some other things that are coming up are medical trauma, post-traumatic stress disorder, and then, like Dr. Young was saying, with continuity of care and insurance issues are also a problem. So what we're seeing in the literature, and specifically some interesting things I was reading recently about adults with congenital heart disease, and not even just adults, but children wanting to feel like they're normal and wanting to be perceived as normal by their peers. This can be really hard to do when you're always sick. You're always in the hospital, you're having multiple surgical procedures with a lengthy recovery time. You're not in school, you're not able to build those relationships with your peers. Whenever you go back to school, you're in a group of students that can't necessarily participate in various recreational activities like your classmates because you've had restrictions placed on you by your medical team. So obviously that's not helping with the bonding process either with your classmates. And then, of course, for all of those same reasons, we know that children with CHD are missing out on different educational opportunities. And then adolescents with CHD are actually receiving less career counseling than their counterparts without a major medical diagnosis. And that becomes particularly problematic later in life when they're trying to obtain gainful employment. They have less chance to do so. And then in addition to that, you have a problem of discrimination on the part of the employer when they learn of your diagnosis. Can this person fulfill these job duties? Can they come to work? Are they going to be absent from work often because of their medical needs? And these, of course, bring up those insurance issues that Dr. Young was talking about. So all of this can lead to depression as one aspect, one psychosocial aspect of CHD. You can see I've listed some symptoms of depression. A lot of people think of depression as extreme sadness, and this is the most common symptom that people think of. But in reality, it can be manifested by anger, isolating behavior, lack of interest in activities that were previously enjoyable, a lack of motivation, lower sex drive, expressing wishes to die, and then having actual suicidal and homicidal ideation. If either of the three things that I just mentioned come up, please contact emergency personnel immediately. How I like to describe depression, because you can say symptoms all you want, it's like you're stuck in a hole, really, and it's a hole filled with mud. You try to climb out of the hole, but you keep slipping down the walls, and you've got family and friends over you on the side of the hole saying, come on, get up, get out of the hole. But you can't. You physically cannot do it. So what's helpful in that situation, an image to give you, if you're a caregiver or a friend or family member of a person who has CHD and they're suffering from this disorder, definitely stand on the side of the hole and say, you know what, I've been in that hole before, let me show you how to get out. And that's gonna be a lot more helpful. Anxiety is another aspect that people are living with when they have CHD. This can be for any number of reasons. Obviously, from looking at these symptoms, it kind of looks like heart symptoms, doesn't it? Heart palpitations, difficulty breathing. Are you having a panic attack or are you having a heart attack? Sometimes it's hard to tell. And this is a common thing that we see. People actually will come into the heart failure center thinking they had a heart attack, and really it was a panic attack. But given that you're heart patients, you definitely want to let your physician know if you're having these symptoms, and maybe they can rule it out for you. How many of you have ever seen the TV show This Is Us? It's a pretty popular show right now, yeah. This season, they had an episode where Randall, Kate, and Kevin went to their family cabin in the woods, and Randall was having a flashback and having an image of his mom running around the cabin, freaking out, trying to close the doors, close the windows. She was trying to keep all of the bad stuff away from her family, right? There's a million locks on the doors, and every time she gets one door closed, a window flies open. She's running across the room to deal with that, and at the end of it, she basically collapses on the couch sobbing because she can't get ahead of it. That's what anxiety looks and feels like, okay, for those of you who may not know. So I just wanted to throw that out there as an image that might be helpful. Of course, we also see medical trauma, post-traumatic stress disorder. Again, as Dr. Young was saying in his talk, coming into the hospital after not having follow-up as prescribed, I guess, it always lends itself to a more urgent and emergent situation. And that situation will be something that frightens people for years on end. There are certain things that may trigger people. I have a friend who personally is terrified about going back on bypass. That's a very common fear. There are different triggers that people deal with, and it's different for every person. Keep in mind a white lab coat might be one of those triggers. Feel free to ask your doctor to take it off before they come into your room, or your social worker, because we have to wear them too. Walking into an ER may also be a trigger for medical trauma and PTSD. If you are having these issues with trauma after your medical procedures, I would highly recommend working with a mental health professional to overcome those, to have some sort of recovery from them, because there are complications, especially if you were a child growing up with these issues in and out of the hospital surgeries. There can be some perceptions that caregivers and the medical professionals who were inflicting these invasive and painful procedures upon you were kind of working against you and hurting you. And we certainly want you to be able to deal with that as you need to. So there are many different ways to help with friends and family members who are suffering from these problems, okay? Going to a mental health professional like a social worker or a counselor is helpful. Following up with a psychiatrist regularly if you require psychotropic medication, that's also paramount. I would say families and friends of people who have congenital heart disease, definitely engage people in conversation about what's bothering them and try to relate to them and what they're describing to you, and be able to empathize with their experience. It may not be helpful to be directive about what you think they should or should not be doing to manage these issues. They already get that a lot from their medical team. Do this, not that. Be the person to build the bridge. Be the person to throw the rope to them when they're in the hole. Go ahead and say something like, this has been difficult for both of us. Maybe we should both go find someone to talk to who can help. I think you'll get a lot further getting someone into treatment by using that approach as opposed to a directive approach. And then continuity of care and insurance. We know, because we're seeing it all the time, people are coming to us emergently for their issues with congenital heart disease. And, just recently I had a patient who was like, yeah, I didn't really know who to go to. He'd been trying to find help for 8 months. And that isn't okay. We're here, we want to help you. Definitely something that all of you who are here can do is spread the word and let everybody know that there is specialized care for them. We're trying to get the word out as much as possible as well. But it's exactly also, I believe, Tom was saying it as well, when you feel like you're well, why do you need to go to a doctor? But if you have a disease that needs to be managed lifelong, you definitely need to continue following up with your medical team just to make sure that everything is okay. So do some research in your own area, wherever you're from. Find whatever resources are available to you. The National Alliance Association of Mental Illness, NAMI.org, is really helpful for different ways to treat different mental health issues. And then, of course, achaheart.org for the Adult Congenital Heart Association, and their ambassadors are very helpful as well. Here in Houston, we have a facility called the Children's Assessment Center, and this facility is specifically dedicated to children who have been through traumatic events. They help counsel those children and their families. So if you know any children with medical trauma, PTSD, because of any experience in the hospital setting, that's a great resource for them. And then there are a number of therapists in the Houston area who also specialize in medical trauma as well. And then when in doubt, just ask your social worker. So, thank you.